good afternoon, and good evening, and welcome everyone to today's Global Cafe. So next week, March 3rd, is World Hearing Day, which occurs every year to raise awareness on how to prevent deafness and hearing loss and promote ear and hearing care across the world. And this year's theme for World Hearing Day is changing mindsets, empower yourself to make ear and hearing care a reality for all. So in recognition of World Hearing Day, the IFA is hosting this Global Cafe in collaboration with the World Hearing Forum to encourage individuals to recognize the importance of ear and hearing health and address stigma and awareness across the life course. So joining us today to discuss this topic is Dr. Carrie Nieman. Carrie is an associate professor in the Division of Otology, Neurotology, and Skull-Based Surgery in the Johns Hopkins Department of Otolaryngology, Head and Neck Surgery. And she's core faculty at the Johns Hopkins Cochlear Center for Hearing and Public Health with the Johns Hopkins Bloomberg School of Public Health and a member of the World Hearing Forum, which is a global network of stakeholders promoting ear and hearing care worldwide. Her research is directed at understanding and addressing hearing health disparities among older adults through the development and implementation of public health-driven approaches to affordable and accessible hearing care. So welcome, Carrie, to the Global Cafe. Really happy to have you joining us this morning.
Thanks, Katrina, and thank you all for joining. Excited to be here.
So we always kind of want to start by getting to know you a little bit better. So I'm wondering if you can just tell us about yourself and how did you become interested in ear and hearing care?
Yeah, great. So I'm a clinician and I'm a scientist. So I have my clinical practice at Johns Hopkins where I see patients in the Baltimore area as well as the Washington, D.C. area. So I see patients part of my time. I operate another part of my time. All of that is, as a ear, nose, and throat doctor, but I am specifically just the ear part, which means I'm an otologist or ear surgeon. And then the rest of my time is focused on research in terms of just like you laid out, Katrina, thinking big picture about the huge gap that exists between how many people have hearing loss and how few individuals have access or do something about their hearing. In terms of just my background, I went to Northwestern University for undergraduate and stayed in the Chicagoland area to do my MD and my Master's of Public Health at the University of Illinois at Chicago, and then went to Johns Hopkins for training in otolaryngology and then stayed on faculty. And I think for me, I think like many people who are interested in the ear and hearing care space, it is just so fundamental to the human experience. And I think to then that other element of when we think about just systematically individuals and communities maybe not having access to effective communication. I think that also, for me strikes something in terms of not only do we need to understand it and know how many people are affected, but I think more importantly, what can we do about it? So I think that's big picture, some of the things that come to mind.
Yeah, thank you. And I think we'll hopefully maybe address some of those questions that you just posed throughout our conversation today. So I'm wondering if you can maybe set the scene for us a little bit and just talk a little bit about age-related hearing loss specifically. How does ear and hearing care specifically affect older adults?
Yeah. So, of all the different forms of hearing loss, by far and away, age-related hearing loss is the most common. And so I'll just speak from kind of a public health perspective in terms of just the numbers. Most of age-related hearing loss is also in that kind of mild to moderate category. We typically kind of grade the severity of hearing loss from mild to moderate to, all the way to severe to profound. And in terms of age-related hearing loss, it is likely a number of different things that factor into age-related hearing loss. By far and away, age in and of itself is the biggest risk factor for hearing loss as we get older. But likely age-related hearing loss reflects a number of different things in terms of, yes, certainly your age, biological, chronological aging, but then also things like your history of noise exposure, potentially history of ear infections, your kind of family history, your genetics, in terms of maybe how sensitive you are to noise exposure. There's a lot of things. I would say at a basic science level, we've made a lot of advances. But in many ways, the inner ear and kind of what is affected and how things are changing in the ear in terms of like what happens one-to-one between changes in the inner ear and how we hear is still very much an area that we're beginning to understand. So, we think about, yep, age, noise exposure, your family history, all of those things likely play into that big catch-all category that we, kind of put as age-related hearing loss. Things to keep in mind in terms of age-related hearing loss, as I said, it's really common. We know in the US, which is pretty similar to many other countries, that when you look at a population level, two-thirds of individuals who are 70 years or older have a clinically significant hearing loss. And then that increases when we look at, everybody who's 80 years or older in a population. Around, almost over 80% have a clinically significant hearing loss. So almost all of us at some point in time are going to experience changes in our hearing. And again, I think many people, when they think about ear hearing care, they may be thinking about individuals who are deaf or hard of hearing, may use cochlear implants or things like that. But at a population level, the biggest kind of group of individuals are people in that mild to moderate range who they may themselves not know they have hearing loss, and maybe others may not know, that they have hearing loss, and that's the biggest, portion of the individuals again at a population, level.
Mhm. Yeah, thank you for kind of sharing a little bit more of the burden on older adults and the specific considerations to do with age-related hearing loss. So, I guess then as a follow-up, I'm wondering kind of what are the common challenges that you see from older adults or when you kind of see them clinically, what are they dealing with when they come in and are experiencing age-related hearing loss?
Yeah, yeah. So I think I maybe back up a little bit in terms of there's a group, that I may not ever see in clinic, and because it takes a certain amount of either for somebody being like, yeah, I feel like I'm having an issue here, that I want to be able to go in and see an audiologist, see an ENT, an otolaryngologist, so and or their family or friends are noticing changes and are saying, hey, maybe you should do something about this. But there is, I think, most people in that kind of mild to moderate range may not ever come and get their hearing, tested or have that conversation. And I think some of the reasons why, in terms of kind of challenges and how it may kind of show up, is one of the biggest challenges of age-related hearing loss is that it's just so gradual. And for many people, it can be really subtle. And so there is just many people be like, it's not me, it's you, I'm not the one who's having an issue. I can, hear many different things and I'm not necessarily struggling. So it's a big process to get individuals from a point where maybe they're aware of some subtle changes that have gradually happened over time to a point in which now they're actually aware of their changes and they want to do something about it. And so some of the ways that we first start to kind of notice changes in our hearing is often struggling in background noise. For the hardest thing in terms of a listening setting is thinking about that signal to noise ratio. And so when there's a lot of background noise, we're not always able to understand clearly. So if you're at a family gathering, at a restaurant, at some type, of social gathering, and you're like, man, I'm struggling a little bit, that can definitely be some hearing loss that is starting to incur. The other ways people will often kind of notice it are things like, I can hear you, but I can't understand you. This kind of feeling that people are mumbling. And so again, it's often, it's not necessarily me who's having the changes, but you're the one who's not necessarily speaking clearly. And there may be some degree of that not speaking clearly, but those are I'd say early indicators of when people are starting to have some changes. And then it's a little bit usually a different level of hearing loss, maybe a little bit more hearing loss when you're struggling one-on-one, in a quiet setting, or if you're struggling on the phone or things like that. Oftentimes we can make changes in our daily life in terms of turning off background noise, turning the TV up, things like that, that we can accommodate in ways that we may not realize that we're having changes. So I think those are some of the kind of the common ways that people may start to notice or become aware. And certainly significant others, family members, who they are often a very good indicator and may start to notice even years before someone is kind of coming to the point where they're saying, yeah, I think I have some difficulty. Their family members oftentimes for years have been aware and have noticed those changes.
Mhm. Yeah, absolutely. And I'm sure you deal with a lot of family members in your clinical practice as well, kind of
Which
saying,
is good. We want, like, I think if anybody is thinking about, saying maybe I should get my hearing checked or I should, see somebody, audiologist, ENT, otolaryngologist, bring your family members. It's a huge benefit for everybody, like communication, right? Like the heart of what we're trying to improve and address, like takes more than one person. And so there's real value in bringing somebody along with you. I think we said always, for any kind of healthcare appointment, but like this is, this too, there's a lot of value in having two people together to think through and talk about and share.
absolutely. So I want to, also ask you about the stigma I think that comes with hearing loss. And, I think people often think that that is just kind of a normal part of aging and there's not really any care that they should get for it or things like that. So, and maybe there are other aspects to this as well. But can you talk a little bit about the stigma that you see in your patients, but maybe also in some of the community settings regarding hearing loss and how, is that something that can be addressed?
Yeah, yeah. I think stigma is it's a tough issue. In that, especially when we're talking about age-related hearing loss or hearing loss that we see, for us as we get older, there's, I think, a lot of interplay, between, stigma around hearing loss, and then stigma around aging and kind of where those things connect. One thing that we haven't talked, so much about is, in the past 10, 15 years or so, we have learned a lot about hearing loss and, what it may mean in terms of healthy aging. And I think, in terms of why I'm connecting this back to stigma is that I think for many very kind of motivated patients who I see who are kind of thinking through and how they are kind of managing, I think, potential stigma related to thinking about wearing a hearing aid or whatnot, or to saying, yeah, I have hearing loss. I think some of the way in which they personally have kind of rewrote that narrative for themselves is I care about my health. I care about how I'm aging. I care that I am engaged as much as possible. And these are the steps that I'm taking to do that, to stay engaged, to stay involved, to stay connected to the people I love. And so I think for many people, kind of that little bit of a reframing of like, these are core things that we do to support healthy aging, just like we think about doing something about our vision, just like we think about, social isolation and wanting to stay connected. Hearing health is like right alongside all of those things. And so I think that's one way in terms of how we may think about, connecting to others, how we may think about it for ourselves. I think it the other, piece of it is that, stigma, which has many different levels and right has a lot of cultural influences as well. That I think the people often who are best equipped to kind of work with and talk with people about what's stopping them from doing X, Y, or Z, are often people with kind of shared lived experiences. When somebody comes to me to see me about, their hearing, they may not be particularly interested in my thoughts about what it means to be, an older adult living with hearing loss, as they look at me and say, you don't know or understand. And then when you add kind of other cultural elements in as well, some of the work we have done in different communities, in the Baltimore area, we have a large Korean American community-based study that we do through faith-based organizations. And we had some inclination around, stigma in that community from focus groups and things like that. And we went to use what would be considered pretty standard and acceptable measures of stigma to try to say, hey, can we, document this in a little bit, in a more objective fashion? And we had so much negative feedback about even those standard questions that we weren't able to even kind of gauge some of those things around stigma in that community. And I will say, some of other communities that we work with in the Baltimore area, we've worked with over-the-counter devices in terms of that are kind of like hearing aids, but not exactly. Some of the ones that we offer look more like a Bluetooth headset, because that was deemed much more acceptable, for members of the community to say, hey, look at my, status symbol. The fact that like it implies I have a smartphone, it implies, that I have this, kind of advanced technology, that was considered, more acceptable than wearing something that looked like a little bit more like a traditional hearing aid. So I think those kind of last pieces, I think, are examples of just how insidious some of these things are. And so I think the starting point is just to at least try to meet people where they are as we work at a broader community to think about both ageism and biases and discrimination that exist, around hearing loss itself.
Mhm.
But it's definitely a challenge, and I think trying to break down, for individuals, what is keeping you from doing X, Y, or Z in terms of getting your hearing checked or doing something. I Having those kind of one-on-one conversations that can go a long way.
Yeah. Yeah, absolutely. And I think, maybe a little bit later on, we're going to kind of speak a little bit more about some of the strategies to kind of increase awareness. And obviously this, World Hearing Day, which is coming up, is really kind of all about increasing awareness so that people, hopefully are a little bit less stigmatized and people have a little bit more of an idea and education about hearing loss and access to ear and hearing care. But I want to, before we kind of go in that direction,
Yep.
I wanted to
Yep.
pick up on something that you kind of mentioned about how hearing care is related to healthy aging and overall.
Mhm.
And so I'm wondering if you can speak to, in people that are experiencing hearing loss, what other, ripples it has in their lives beyond just the physical and the biology of it,
Mhm.
and
Mhm.
just
Mhm.
in terms of their ability to connect with others or their
Mhm. Mhm.
ability to engage in with their families, with their friends, all of
Yep.
these kind of different ripples, their ability to work.
Yeah. Yeah. So I'll just make again, there is the kind of the medical, the clinical, like one-on-one as you're, kind of counseling somebody versus kind of what we know from a public health perspective. And public health perspective, what I'll say, we have kind of large scale studies of large communities, large populations that we can say some general things, but they don't translate, directly to one saying that, every person with hearing loss does X, Y, or Z. So just with that caveat, when we look at kind of these community based studies or large nationally representative studies, we see pretty consistently kind of negative effects related to even a mild amount of hearing loss to almost every aspect of aging. And that's when we control for a lot of other variables. So again, like not saying like person has hearing loss, they automatically have this. These are the things, that we see. So it goes all the way, from things that, make sense, right? In terms of hearing loss and having difficulty with communication or feeling, like they're having difficulties with their communication in social settings. So, really kind of immediate things that we think about to then things like we see increased, levels in terms of depression, of social isolation, of loneliness. We see, things like falls as well. So increased risk of falls, when we are thinking about like where our body is positioned in space and how we navigate space, there's a lot of auditory inputs along with many other types of inputs that we get. And so when there's changes there, again, even at a mild degree, we can see kind of this increased risk of falls for things like hearing loss. We see things like increased medical costs, healthcare costs in terms of expenditure, decreased satisfaction with healthcare systems, and interaction with providers and things like that. And I think the biggest thing that I think many people, it has been on the radar is an increased risk of accelerated cognitive decline or dementia. And again, those are things that we look at a population, we try to control for as many variables as possible to try to say, these are comparable. And so even at a mild, level, we see a very consistent relationship between changes in hearing and then changes in terms of memory and risk factors related to cognitive decline and dementia. Again, at a population, level.
Mhm. Yeah, thank you. Really, it truly does affect, a lot of aspects of people's lives that I think maybe you wouldn't realize, like the falls and even dementia or the kind of cognitive aspects of that. So I'm wondering if you can share a little bit more about that aspect of
Mhm,
hearing
mhm.
loss and the relationship to cognitive health.
Yep, yep, yep. Um, so it is a tricky kind of area because it's still there's a lot of things that are still evolving in this space in terms of our understanding. The Achieve trial was the first and largest randomized controlled trial that was done to try to help give us information about kind of this question for somebody who has hearing loss and has normal cognition, normal, healthy cognition for their age, does using hearing aids slow cognitive decline, right? And so we use randomized controlled trials in healthcare and in science to help us say if we, try to keep all these things the same and we change one variable, what do we learn about that? And so the Achieve trial finished up now a couple years ago. It was based at Johns Hopkins along with many other institutions across the United States. And recruited almost 1,000 individuals with hearing loss. And again, normal, healthy cognition. I believe they were all over 70, I believe, but they were older individuals. And half were randomized to receive gold standard hearing aids fit by an audiologist, all the bells and whistles and everything, and they were followed for 3 years. And then half were randomized to just kind of get some health education sessions that were the same number and amount and everything to kind of to match in terms of the interaction that individuals were receiving with the hearing care intervention. And so overall, at 3 years later, after people have been using their hearing aids and things, what they found for everybody as a whole was they didn't find much change in terms of cognitive decline. But in one of, to now give a little bit more nuance to that, is that that almost 1,000 individuals that were in that study, they came from two different groups. One group had been part of a ongoing research study, just observational, meaning they weren't, getting interventions or things like that, but they've been 30 years in a study being kind of observed and monitored. And that group of individuals were actually randomly selected way back when they entered the study. And then the other part of the study, individuals were healthy volunteers just from the community saying, hey, I've got hearing loss. I think I'm ready to do something about my hearing. I want to be part of a study to learn about, am I having, changes with cognition, get a hearing aid as part of that. So there's these two different cohorts. And so what they saw in the cohort of the individuals who were healthy volunteers who were signing up for a study, very motivated, individuals, is they didn't see when they looked at changes in cognition over those 3 years, there really wasn't much change in those 3 years. So whether you used a hearing aid or not, you weren't going to necessarily see a big effect in terms of changes in cognition. The group that had been randomly selected and from this, other study that were just kind of being followed, that group had more risk factors for cognitive changes in that they were older, they had, more cardiovascular risk factors, things like that weren't exactly the same. And so when you saw that group, there was some change in cognition just in that group overall. And so in that group, when there was some, half got hearing aids, half did not, the half that did get hearing aids, there was a 48% decrease in their cognitive decline. So for in that group where they actually had some changes that you could see, differences, there was, a pretty big effect in terms of hearing aids. That also raises a lot of questions, but we think we're starting to see, some evidence. It's definitely not set in stone or universal, but we're starting to see that for those individuals who may be most at risk for changes in cognition, that there may be some benefit for hearing aids. While I said that was all just 3 years, all of these individuals, as many as possible, are being now followed out for 6 years, hopefully 9 years, so that we can continue to follow these individuals and learn more and see. So I know it was maybe a little bit in the weeds for things, so happy to go over any other questions of things like that.
Yeah, no, I think that makes sense. And I think it's rapidly evolving. I think with the research that is coming out is the key takeaway. But there is, I think it speaks to your point in that hearing is related to many aspects
Yep.
of
Yep.
the aging and
Yep.
living a healthy life.
And I will say just one other thing about that. I don't know, for how many people are kind of following and aware of, some of the new dementia medications, that are out there that, you know, have to be are very, very expensive, have to be, very highly monitored, and have potential side effects and things. And, to back up in terms of what we're talking about here as an intervention, right? In terms of has still many questions about, can it slow cognitive decline? Can it prevent dementia? Like those are still very, far away. But the fact is that we're talking about is a non-pharma, like this is not a surgery, this is not a medicine, like this is a very low risk type of intervention that we're talking about. So, I think, when it comes back to, for me as a clinician, whatever is motivating you to say, yeah, I'm ready to do something about my hearing, this, doing something about your hearing is something that has relatively low risk, and it can potentially have some, big picture benefits, certainly for as individuals and for your immediate, family.
Yeah, absolutely. So I do actually want to go
Yeah.
to questions in the chat.
Yep,
Um,
please.
I'm going to start with a question from Shmuel, who is
Mhm.
quite a regular contributor on our Global Cafe.
Yeah.
And they're asking, what should be the role of authorities in ensuring healthy hearing for young and older people both?
Yeah.
Mhm.
So it's a great question. And I think when we're thinking about hearing across the life course, I think for many of us, we think about from all the way from newborn hearing screening, so making sure that there's authority, that there's regulations in place in terms of ensure access to newborn hearing screening, and that there's established ways in which people can be referred in terms of to get access to resources to support access to effective communication, all the way to thinking about healthy listening, whether we're talking about in, clubs, personal devices, occupational settings, kind of the whole spectrum of things of kind of what we think about in terms of helping kind of regulate noise exposure and making it safe throughout kind of the many different settings and aspects of our lives. I think there, in terms of other roles for authorities, from things like how we think about hearing screening and hearing testing, and what is supported and recommended often has some interplay with regulatory from a medical side or government side in terms of standardizing access to screening. And then I think there is also a role for what authorities say in terms of appropriate regulation for hearing aids and devices like that. In the United States, we now have had for a few years over-the-counter hearing aids in terms of trying to aim for appropriate regulation of devices so that people can get access to safe devices that meet quality standards while aiming, at the same time to try to reduce the cost in terms of devices to individuals. So I think there's a lot of roles. And then in addition to, roles around authorities of scope of practice. So, who do we think of is able to provide assistance and support for individuals with hearing loss, from otolaryngologists and audiologists, but are there roles for other individuals who are appropriately trained to help provide support for the many, many individuals we know that our current resources, aren't able to provide support for? So I think those are some of the ways in which I think about authorities or regulation can certainly play a big role and across the life course.
Mhm, mhm. Thank you. And I think this kind of relates, some of the points you mentioned relate to a question from Anna Maria,
Hmm.
which is asking about um, annual hearing tests for older adults, and should that be compulsory in order to detect hearing loss and address the issue?
Yeah, yeah. So it's a great question, and it's while it may seem like a simple question, there's a little bit of kind of, yeah, discussion there. So um there, in the United States, as well, it seems like Canada too, there are not standard recommendations like colonoscopies, mammograms, all of these things that we kind of do as part of our health checks. And some of the reason why we don't have those in place is because there has been traditionally a lack of evidence to be able to say strong enough that it matters to at a population level, 100%. Like if somebody's having some changes in hearing, they should 100% get their hearing screened, tested, like all of that. But just for, you know, asymptomatic national screening, everybody gets screening regardless of whether or not they're having any questions or concerns. There hasn't been enough evidence in the past to say, hey, it matters to catch somebody at some point in time, like say a mild hearing loss, and that it then matters in terms of doing something about it. And so there's been a lot of work in these past, 5, 10, 15 years to try to help build the evidence to say, yes, it matters, because I think we all think that it matters. All of the professional societies, the World Health Organization, we all have recommendations that screening should start, whether it's 55, whether it's 60, 50, in that range. But what has been a big sticking point is that we haven't had whereas something like colon cancer screening, breast cancer screening, like the amount of kind of research dollars, the amount of, what we know in those spaces is much, much greater than what we have traditionally known, about age-related hearing loss, even though it is so common. For far too many years, it has been considered just this, benign part of aging, and it hasn't had some of the same kind of support and dedicated effort. So, do I think personally, I think it would be great that if we could have standardized screening, but from a scientific perspective, there are a number of different things that do need to fall in place for, I think, for really broad spectrum
Mhm.
but the WHO, and I know Luana posted early, has some recommendations about screening really across the life course, and kind of the thought process from the World Health Organizations and I think many professional bodies is that we need to start somewhere, and one of the ways in which we can start is to start and gather evidence and build that evidence as we go along. So those are some of the thoughts there.
Yeah, thank you. And I guess maybe a quick question. Do you find that in primary care there's, a lot of people are getting information on hearing loss at all? Like what is the communication, I guess, like in the primary care setting on hearing loss? And then
Yeah,
maybe just another fault. There's a quick question from Adriana
sure.
about what for screening, what test you would suggest.
So the screening for a test, so the there are there's many different guidance. It always will come down to available resources that you have. I think the goal, not the gold standard, but the thing that many times we're trying to be able to get to a point is to have, some basic pure tone audiometry. That's where you play different tones at different levels, and you can kind of get a little bit more of a sense of somebody's hearing ability, versus like whisper or finger rub. Like those are things, but it's very hard to standardize those things. And so why I say kind of those pure tone on, because there's been a lot of advances in how those tests can be done in terms of from a smartphone to a tablet. All of the work that I do in a community-based setting is all using really standardized, equipment from a smartphone, from a tablet. There are some great devices out there. There's more and more apps that are out there as well. They're definitely in the screening category. They're not diagnostic, but it definitely opens up the avenues of being able to have some more objective measures that are available and even available, free. Um,
Mhm.
and then the second the second question can you repeat it again just to make sure I don't go too
Yes.
far on a tangent?
Yes, I was just curious, like what kind of education are, our primary care providers and, healthcare providers in the community um, having conversations about hearing, even if they're not able to do the screening or that's not part of their regular protocol, but
Yeah.
are they, is there a level of education that's happening?
Yeah, and so I welcome for anybody who is in primary care to join in, as I'm certainly not a frontline primary care provider. But there's been a lot of interest in working more closely at a primary care level to help bring this, forward. And I would say just from, clinical practice guidelines that I've been involved in, including the American Academy of Otolaryngology, we view every single person, whether it's a physical therapist, an occupational therapist, if somebody is having some difficulty with hearing, like everybody should be thinking about it. So not just, primary care, but just because it's so core in terms of being able to work and connect with your patients. So there's been certainly a lot of interest in primary care. I think that is always, though, tied with the reality that we always ask our primary care colleagues to do more and more and more and more with less time, less support. So there is that balance of where does that go? But it is also kind of intertwined with, the more that we can learn and understand and build the evidence around hearing, like hearing screening and making that, a very standardized thing that, ideally would go into that long checklist of things that your primary care doctor is going through. So it's definitely part of the mix, but I think it's going to take all of us, and it's going to take everybody, even who may not, be an ear and hearing, expert. I think that it has to be on top of mind, just like we make sure our patients, can see, understand, and hearing, goes right along with that.
Yeah. Um, so I'm gonna try to get through quite a few questions here, bear with me. So a question from Dr. Mahesh, who is asking if there's any resources or anything that's been studied on nonverbal cues to communicate with older people who have hearing loss or a hearing disability.
Yeah, yeah. So there a big part. So when we think about hearing loss, and management of hearing loss, there's kind of two components to it. There's the sensory management side of things, which would be like, let's think about hearing aids. If it's more advanced, let's think about cochlear implants or things like that. But then the really core component of hearing loss, management is what would be oral rehabilitation. So basically communication strategies, things that for that most of us know that maybe seem obvious, of things like make sure you get face to face, make sure you decrease background noise, try not to scream across the room, try not to scream across the house, because we get a lot of cues from lip reading, we get a lot of cues from gestures, from, kind of just emotional, like facial expressions. A lot of those things help fill in the gaps. And again, what I'm talking about here is much more in the age-related hearing loss. So we're talking about mild, moderate, for individuals, it who, may not be using kind of oral communication. Like there are other certainly areas, but what I'm talking about here is kind of bread and butter age-related hearing loss for many people who are in the hearing and speaking world. Those kind of simple things like get face to face, decrease background noise, try not to do things like, you can say what or huh, but try to minimize that instead of, trying to be very specific about, well, I heard you say blah, 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 but I didn't hear you say blah, blah, blah. And if you're on the other end of that, that you don't just repeat the same thing over and over again. You can repeat once or twice, but then try to change up your words, to give people a shot at being able to hear, understand something else. So those are some basic communication strategies that, come alongside thinking about a device. So I don't know if that maybe gets at in terms of some of the cues that could be helpful for people.
Yeah, yeah, absolutely. And then switching over to kind of the device
Yep,
side, Nan
yep, yep.
asking, how does, with so many devices on the market, how do you choose? How do you select
Yeah.
a hearing aid provider?
Yeah, yeah. So this depends a little bit in terms of where you are in the world and what's available, to you. There are only five traditional hearing aid manufacturers. I know that's a very common question that I get from patients of, oh, which hearing aid should I get? Or and I will say from my perspective, they're all very, very good. There's, a lot of competition in terms of for the different bells and whistles. So if you're talking about a traditional hearing aid, I don't think that, you would usually be getting that in partnership with, an audiologist or a hearing aid dispenser, hearing instrument specialist. For devices, excuse me, that you may be, navigating or getting on your own, like in the United States, getting an over-the-counter hearing aid. There's kind of two different levels of over-the-counter hearing aids in the United States. One category, which is kind of the highest category in terms of the rigor in which the devices have gone through and are FDA like independently checked, in terms of the standards that they meet. And that category is called self-fit over-the-counter hearing aids. And there's only a few that fall into that category right now. And so when you're looking or navigating, especially for the United States, you want to try to look for something that says self-fit. Other ones can be good and may be good, but it is tricky in terms of kind of maybe knowing ahead of time. So I know there's a number of different websites that have some online reviews. I don't know if I would necessarily go just with the like Amazon review profile. I think it's really important to check, how long will you have to like return policy to look through that. Um, the Hearing Loss Association of America, where I sit on their board, has a number of different resources available. That's HLA. I believe it's hearingloss.org, but I'm not sure, Luana. In terms of they have some guides to navigate the over-the-counter hearing aid market in terms of like a checklist of things to kind of think about as you're looking at a website or a product and trying to assess it. And
Yeah,
that's a nonprofit, they're for consumers. They're not necessarily pushing a particular device.
yeah. Yeah, that's certainly a good tool. Um, and then, so we have a question as well on just the cost of hearing aids and how to ensure access for low socioeconomic groups. And so I'm wondering, I think access is always something that we talk about as as sort of being one of the challenges that comes with hearing aids or even just hearing care in general. So is there any kind of strategies to address those in
Yeah.
lower socioeconomic?
Yeah, yeah, yeah. And that's exactly where, we are trying to focus our work as well. So thank you for the question. While I just named a number of different devices, there are certainly devices out there that are more affordable. They are certainly devices can and need to be cheaper. Um, but there are things that are changing. So um things like a Pocket Talker or Super Ear SE9000, those are two devices that are larger. So it's like a pocket size, kind of like a hand palm size device that has like kind of earbuds or earplugs. They may not be for everybody, but they run, at least in the United States, around $150 for those. So they're also really great options for somebody who has had issues in terms of arthritis, had a stroke, has some cognitive impairment, because they can be placed on and off, by somebody else, like a care partner. So those are some devices. There are also other ear level devices that kind of fit in the over-the-counter hearing aid technology space, that look like a hearing aid, can be fitted like a hearing aid, that we've used. And instead of, for example, buying, two, you can buy one, and one of those, and that even at the higher quality level can range around $250, $400 for a single one. So um the devices do exist, but there are, and I think that's one of the hopes and dreams that we have for the over-the-counter hearing aid market in the United States, is kind of this downward pressure to provide more options in this space. So there is a lot to be determined about the over-the-counter hearing aid market. We're still just in the very midst of it. I know there was mention in the chat about AirPod Pros. I think that's an extremely exciting advance. Obviously, somebody has to have an iPhone, and there's a lot of other things that, go into that. But, that software as, technology, like the fact that how many millions of people across, the world with like just a download of a software update, have access to full-blown hearing aids, that's a huge advance. There's, I'm sure some people may have seen in terms of glasses that can kind of function as hearing aids that are coming out. And, these are the types of innovations in this space that we're hoping will lead to more choices for people with hearing loss, and the hope of driving down costs. We're definitely not there yet, but there are options, and I'm hopeful that more options will come.
Yeah, the innovation is really so crazy that we're seeing. So that is very exciting. So I'm gonna kind of merge a few questions. And
Sure.
Antonio is asking, you know, about the effect of kind of loud music and listening habits um, on age-related hearing loss and what the
Mhm,
correlation is between those two things. And then we also
mhm,
had a question from David on tinnitus and the impact it has on
mhm,
hearing.
mhm, mhm. Um, So, the listening space, the only thing that we can do as individuals to prevent hearing loss beyond just healthy living is thinking about noise protection and thinking about kind of your day-to-day exposure, whether it's, from even just basic things like using the vacuum cleaner for a long period of time, or power tools, or mowing the lawn, or what, kind of maybe seemingly routine noise that you're exposed to. Those that the single thing you can do is to use hearing protection and to use hearing protection regularly. With that said, it is hard to there's it in terms of we think that there's a lot of exposure to noise and to different listening habits, but it isn't 100% clear, because we know for many people they generally listen at a safe level. That's not true for everybody, and there's been a lot of work by the WHO to kind of put in limits or at least inform people about how much kind of listening and noise exposure they're having. So there is a lot of work there, but it isn't, I can't say that it's one to one that, a lot of noise exposure is not always going to be the same. It doesn't guarantee that it's age-related hearing, and at the same time, if you are really, really good about protecting your hearing, even from a young age, that doesn't necessarily mean you can avoid age-related changes in the end. There's probably a lot kind of that happens in between there, going back to genetics, your susceptibility, things that we can't necessarily know or label right now in an everyday, kind of clinical setting. So, I would love to be able to draw a very straight line between 100% yes, safe listening does matter, but it isn't a 100% guarantee that will avoid all of the impacts in terms of hearing loss as we get older.
Mhm. Yeah, absolutely. And then we another question. I know we're coming to the end, but this will be kind of, I think, our last question. And thank you everyone for being so engaged today. So Adriana was also asking to go back to kind of the relationship between hearing cognition. What role
Mhm.
does cognitive reserve play in that relation?
Yeah, yeah. So great question. And I think this highlights the questions around mechanism. We do not, for we again, it's still very much under debate and consideration. What is the relationship between hearing loss and cognition? But as part of trying to figure that out, there are a couple different mechanisms that we think they may be related. One of them is thinking about cognitive reserve, in terms of when you have hearing loss and you're spending kind of this, cognitive reserve on trying to figure it out, this garbled signal, is that taking away in terms of processing from other things? So is there something there in terms of cognitive resources and use of cognitive resources? Is that kind of how it's connected? The other kind of theory or kind of potential mechanism is, are there structural or functional changes that are happening with hearing loss, in the brain that are then kind of leading to these changes that we're seeing? The third kind of possibility is, we know many of us and have seen from our own experiences that when we have some hearing loss and we're struggling to connect, particularly in social settings or things like that, then we withdraw and we may not be as engaged as we once were or would like to be. And so is that kind of the way in which, we know social isolation, loneliness, like that alone can be a driver for cognitive decline and cognitive changes. So is that the potential mechanism that these things are related? And then there's the last kind of potential is that there's just some kind of common cause, that's connecting both hearing and memory changes that connects them together that we don't yet know. But those are kind of the different areas and the ways in which we think. And some of the work that's coming out of seems to kind of indicate that there's some of each of these. There's some support kind of for each of those potential mechanisms. So it may not be just single one. It may be that it's having some effect on a lot of these different areas.
Mhm. Yeah, thank you so much. So, unfortunately, we are coming to the final minutes of the session. Thank you so much for addressing many of the questions, and I think we got most of them. But I'll kind of take a couple minutes here just to introduce our speaker for next week's session, and Carrie, give you a few seconds to pull together some key takeaway messages, and then we'll come back to you for your final takeaways from today's conversation. So I'm very pleased to introduce our session for next week's Global Cafe, which is going to be with Miss Elenia Geno, who is a project manager at Age Platform Europe. And we're going to be speaking about developing and implementing age-friendly environment training. So really hope that you all can join us next week for that session. And then Carrie, just to come back to you for your key takeaway messages in our final moments.
Sure. I think for all of us, individually, to just know, and kind of spread the word that hearing health matters. It's something that matters for us individually. It's something that matters for us as a society, that we need to be thinking about it. We need to be talking about it. There is certainly action that can be taken, whether it's from safe listening habits, from getting your hearing screen, just to know where you are at, to actually then doing something about it. And I think for anybody who's involved in thinking about policy in terms of regulations, we have to have hearing health right alongside everything else we're thinking about in terms of healthy aging. And we need to be thinking broadly, and that we cannot just be doing the same thing over and over again in terms of thinking about all of the new types of technology that are coming. How do we get more access to individuals, and how do we support all of our older adults in getting access to the care they need, and to think again as broadly as possible, to meet those needs and demands. So
Well, thank you so much, Carrie, for sharing so much information. We really ran the gambit of topics, so thank you so much. And another thank you to the World Hearing Forum, who really supported us in putting on this global cafe. And we really encourage everyone, of course, to keep an eye out for some of the resources that are going to be coming out on World Hearing Day, and the different campaigns and education that will all be working to raise awareness of ear and hearing care. So World Hearing Day is March 3rd. It's coming up, so everyone please, keep an eye out for that. And again, thank you again to the IFA team that helps us to put on our Global Cafe every week, especially Luana Colnelgo, who is with us every session here on the Global Cafe. So have a great weekend, and hope to see you all at our next session.